Hello, I'm Dr. Dennis McKenna, and today I'm joined with Chris Couché. Chris, it's great to have you here.
Thanks, Dennis. Appreciate it.
Chris, of course, is our Chief Information Officer. I think you've been here a couple times in the past.
A few times, probably 3 or 4, yeah. Absolutely.
Great to have you back again.
Thanks.
Today's Thursday, April 13th, giving you the update from Albany Med. So, Chris, just a couple things to start. We recently had the Joint Commission here, and I know that Joint Commission looks at areas that you also oversee as well. And I want to really commend the workforce. It was a spectacular survey. They were here for 5 days. They had over 5 surveyors. They look at literally thousands of different standards. And the campus really did a wonderful job. And we haven't gotten the final report yet. We have some things that we need to address. But overall, they left here with very positive comments about the workforce and the work we do here. And I think, obviously, we should be very proud for that survey.
It was an excellent survey. Best I've seen in 30 years.
That's what other people
Amazing.
said as well. Someone else said to me, of all the surveys that they had been here as a member of the workforce, it was the best one. So
Absolutely.
thank you to all of you who helped make that happen. Also, recently, we were surveyed by the American College of Surgery with our adult trauma survey for a level 1 trauma survey. And we had also previously been surveyed for pediatrics. Another incredible survey, really credit to the team led by Dr. Kurt Edwards and Kerry Snyder. And while we're waiting, I think, for the official word on that, that was also a very positive survey. So congratulations to them as well.
That was great.
All right, Chris, I know that you're here, so it's an opportunity for us to talk about Care One and cybersecurity. To remind our listeners, Care One is what we're talking about as far as putting in a new ERP and a new EMR. So why don't we start there, and then we could talk a little bit about cybersecurity.
Thanks, Dennis. So just a reminder of where we're at with the individual Care One projects. So Workday, which is our enterprise resource planning system, is in test. So essentially the team is testing the thousands of different scenarios that are built into the system. And once they're done with that testing, again, they'll plan to go live, but going very well so
Excellent.
far. Moving on to, and then I'll just mention that we do have demos this week and next week. The team is actually looking at and demoing the application so that people who want to join either in person or via web, there should be a message that had come out with all of those dates starting yesterday through next Friday. So if you're interested in understanding what that system looks and feels like, please attend.
Absolutely.
We'd love to see as many people to take a look at that. I think we've already had over 400 in the first, just in the first day, look at that system and watch the demo, which was excellent.
Great.
Moving on to Epic, we're in what's called the 4th build wave right now. So the teams are working hard at this last wave of build. And then once the build is done, again, they'll start to do the individual testing of the specific functionalities. So within the next couple months, we anticipate that build wave will be done and we'll actually be on to testing, which is obviously a critical part to make sure that what the teams have built actually works. So good progress going on the Epic side of the world as well.
So just before we move off Care One, just to call this out, obviously you're one of the executive sponsors for this, along with Fran Alpert on this campus and Dr. Cliff Belden from Columbia Memorial Hospital. As we've said many times, this is a system project. The ERP and the EMR will be across the entire health system. So that will include Columbia Memorial, Albany Med, Saratoga, Glens Falls, and eventually the VNA as well.
Absolutely.
This is the singular biggest, most transformative project we've taken, largest scale like this as a system. I often describe it as the neural network that will lash our system together. So you cannot overstate the importance of this project.
Agreed.
And a credit to people who are making it happen.
Yeah, agreed. I'll just mention 50 plus different teams from all 4 campuses. So just an amazing amount of camaraderie and collegial activity that's going on between the 4 campuses.
Let's talk about cybersecurity. I know this is an area of intense importance to you, as it should be really to all of us. And I know today you want to share a couple tips with people about things that they can do to avoid getting caught in the cybersecurity trap.
Just some facts and some reminders. So healthcare in general is the most attacked business sector in the country. And the reason that we are is because we have the most valuable data. So think about all the millions of records that we have just in our system alone, and think about how much that data is worth to a criminal who then can sell that or blackmail somebody, whatever it may be. So that translates into us being attacked. Our system is attacked all the time, every day. And I like to say to our peer execs and Dr. McKenna and the boards that everything that you see on TV or in a movie happens here from a cybersecurity perspective. And I say that to remind people that we could put in all of the technologies that we do, but at the end of the day, we are still vulnerable if we as the employees give away our data or give away our information. So just a couple of tips. Nobody will ever ask you for your password or for your multi-factor authentication code. We call that system we call Gemalto. Nobody will ever ask for that. And if somebody does, call it and do not give them that information. Hang up the phone, stop the email, call somebody in the cybersecurity team so that we can investigate, because nobody should ever ask you for that information. On the same token, Dr. McKenna, Paul Sameka, Dorothy Urschel, Jill Van Kuren, they will never email you or text you and say, hey, can you buy me some gift cards because I need something for you. This is a common ploy that criminals use, and they use people's names who are in power in an organization to make other folks that work for them do things that they then abuse, right? And we've had all of those types of situations occur here as well. And then again, finally, we talk about the unapproved use of applications and the unapproved use of data. So we just heard that a large corporation in the US was just breached because people started to use ChatGPT, one of the AI things that have been in the news quite recently, to do work. And they've allowed confidential material to be put up into ChatGPT. And there are reasons around how that works, but again, we take a lot of effort to assure that the companies that we work with and the applications that we use and the way these companies use our data are very well defined so that we don't give away our PHI, our PII, or our other confidential data. So just a reminder, again, if you're looking to use an application for a reason, please just escalate that to IT. We'll take a look at it. We'll let you know whether it's secure or not, and then we go on from there.
Great advice. Great advice. On emails, there's a button there that they can even click that says report suspicious.
Yeah, you got it.
And if they want to call a number, what number should they call if they want to report something?
So call the Albany Med Help Desk, which is for everybody. It's extension 25000 or 262-5000, and they will escalate that that call up. So,
excellent. Great advice.
Thank you.
Thank you very much. All right, let's transition and let's do an iCare Award. And while Chris is pulling that up, I will remind everyone, CARE stands for Compassion, Accountability, Respect, and Engagement. And every month we have somebody who we recognize who embodies all of those great attributes. And this month...
It's a great program. And this month, the iCare recipient is Drew Brantley. So I'm going to read the note that was sent in here with Drew. So Drew Brantley, Scheduling and Patient Services Lead in Inpatient Psychiatry, was presented with an iCare Award. In her day-to-day duties, Drew organizes legal documents, coordinates transfers and procedures, schedules for attendants and residents, and is often the first person family members speak to when calling the unit to talk with providers. And that's so important. It's that very first piece that a family sees. She's also a positive force in her department, organizing baby showers and potluck lunches, celebrating birthdays, and coordinating the department's holiday gift drives. One colleague mentioned of Drew is smart, efficient, and wise, and residents, students, and attendings all rely on her to keep things humming. Great testament to Drew's dedication to Albany Med and to what we stand for.
Yeah, she was lovely when she came down and got her award, so congratulations to Drew. And then we also have two Daisy Award winners. First one is Micah Woodworth, who's an adult stat RN, who was honored with the Daisy Award. Micah was nominated by a patient's spouse who wrote that Micah guided her to her destination and comforted her while she was in the hospital for her husband's surgery. Quote, not many people take the time to help a stranger in distress, especially when they're trying to make their way home after a long shift, but this incident will stay with me always. And Micah even visited the patient on the following day. So congratulations to Micah. And then Allie Earl, who's a registered nurse, a pediatric stat nurse, was honored with the Daisy Award. And Allie was nominated by a mom of a 3-month-old who wrote that Allie demonstrated her knowledge and experience as a pediatric nurse and immediately became her daughter's advocate, that's a great word, during her stay on D7. Allie quite literally saved the day. Her care and compassion truly put our minds at ease. Allie provided the absolute best care for our daughter, and I will forever be grateful for her. And Allie's also a friend of mine. So
That's great.
I congratulate both of them, Micah and Allie. Thank you for being the best of our workforce. Finally, Chris, I'd like to leave with this here. I am asked by the medical college to talk to medical students as part of their capstone lecture series. I'm a graduate of Albany Medical College, and they asked me to come back and share my experiences both as a physician, as an administrator, as a leader, and give them some advice. Yesterday was the last one of the year, so I flipped the script a little bit, and I asked them to give me advice and things that perhaps I could tell the incoming medical students. And I took notes, and let me just write down a couple things they told me. And I think these were all great. Your opinion matters. You have earned the right to have an opinion. Right? So as these 4th-year medical students are on the floor caring for patients, they realize they can be an advocate. Great. Don't put yourself in a box. It is okay to permission yourself to do things differently than other people. Right? There's not just one way to do things. Cultural change happens one person at a time. Budget time for yourself. Budget time for yourself. Take care of yourself. Create a winning team around you that supports you. That's so important as well. And finally, do not make assumptions about what people's intentions are. And I think that speaks to speaking to people directly and having really honest conversations with them. So I thank the medical students and for giving me that advice. And in turn, I'm going to share that not only with you, but with the incoming medical school class when they come in the summertime.
That's awesome.
Very good. All right, that'll do it. Weather's beautiful.
Beautiful.
All week it's been beautiful, and we hope it stays that way. For those that are here working, especially on the weekend, we thank you now more than ever for being here. And we'll be back again in a couple weeks. Chris, thanks for being here.
Thank you, Dennis.
All right, very good. Take care of yourself, take care of each other, and we'll see you in a few weeks.